Welcome back to Breakfast Television, and back to talk about a very serious topic, something I'm sure many of you have heard. Probably had somebody perhaps in your family, perhaps somebody older in your family that has suffered from shingles. And here with all the details, I'm joined by Dr. Zach Levine from the MUHC. Welcome back to the show, Dr. Zach. Great to have you here. And I was telling you, this is something, I don't know why, but I've heard so much about it. You know, I've had family members, I have friends of family that have suffered from shingles. And it can be so incredibly painful. So first of all, describe, what are shingles exactly?
So shingles, if you get shingles, basically what you get is a rash. It's a rash with blisters.
Okay.
And it's usually painful. It's like this nerve pain, which is burning and itchy and very uncomfortable. And often, actually, you have the pain before you have the rash. So sometimes people go to the doctor with this pain on their side or wherever. It can be anywhere. And they say, and the doctor looks, he doesn't see anything. And sometimes just the pain, though, the doctor will know, oh, it sounds like the shingles coming on. But then the rash always comes out, and then it usually hurts. But in some people, like you're saying, some people develop this post-herpetic neuralgia, which is this nerve pain that can last a long, long time and is terrible. So
what percentage of people that get shingles would end up in that situation?
Approximately, it's less than I thought. Approximately 10 to 15% of people who get shingles, and about 20 to 30% of people get shingles. So, but the thing is, the people who get it, it's terrible. So we want to do everything we can to prevent both shingles, and then if you do get shingles, to prevent this neuralgia, this pain syndrome.
Before we get to prevention, what can cause shingles?
So shingles is actually, it's the chickenpox virus.
Really?
Yeah.
Okay.
So it's called varicella zoster, and zoster is shingles, varicella is chickenpox. And it's the same virus, but what happens is most of us get chickenpox as kids, or now a lot of kids are vaccinated, but we're exposed to the chickenpox virus. And then it actually lays dormant in nerve cells for the rest of our lives. And then for whatever reason, sometimes when you're run down or if your body's run down, it will come out again along the path of that nerve cell and cause shingles, which is this painful rash.
Is it contagious at all?
It's contagious. Shingles itself isn't contagious as shingles. Like, you don't catch shingles from someone else, but the virus is. So you can catch chickenpox. If you haven't had chickenpox, the virus can be transferred to you. And it's basically, it's mostly by contact. And the people who have shingles, it's contagious until all of the lesions are crusted and dried over.
Okay.
So if it's by touch. So until that time, really, you should either keep it covered up or stay away from people. It's especially dangerous for pregnancy because there's something called congenital varicella, which is pretty dangerous for babies. So if people are planning on getting pregnant, it's important to stay away from them, or they should stay away from people who have active shingles.
So you should stay home from work pretty much if you have that scabbing, that scaling still until that's gone.
It depends what you do. Like, certainly if you work in a hospital, or you work with people who are immunocompromised or chemo patients, anything like that, stay home. If you're working in general, if you're able to cover it up, and not only with a bandage, but also with a shirt and whatnot, it's not really a danger. If it's on your face, basically, or somewhere that's exposed, you basically have to stay away until it's all dried and crusted over.
You mentioned prevention, so let's talk about preventative measures. What can we do to avoid shingles?
Vaccine.
Okay.
Yeah, so the vaccine, there's two vaccines. Actually, there's one that was just approved last month, or October, so now it's 2 months ago, in Canada. It's called Shingrix, and the other one was called Zostavax, which is still around, and that was approved in 2009. And they're quite effective. The new one is apparently even more effective at decreasing both whether you get shingles, so that's the first thing, ideally. But then even if you get shingles, you'll get a more mild form of shingles. And even if you get the mild form of shingles, the risk of you getting this neuralgia, this pain that lasts a long time, is cut significantly. So it's worth looking into, and it's for people, mostly the recommendation by Canada is 60 and over. You can get it once you're 50 and over. We don't know how long it lasts, though, so you may need a booster later on in life to make sure that you're still immune. But it's worth looking into. It's worth talking to your doctor about.
So obviously, as we get older, we're more susceptible. That's the idea? Why is that? Our bodies are just getting older and more susceptible.
Yeah, I don't think they know 100%. And anyone can get it. I mean, shingles can happen in children, but definitely more likely to get it as you get older. It has to do also with your nerve cells getting older, and they release certain things, including this virus. And the risk of having it and the risk of having pain increases as you get older. So if you have shingles when you're 40, the risk of having that neuralgia, that pain, is less than if you have it at 80. So that's another reason why it's really recommended as you get older to look into having this vaccine.
You mentioned the vaccine. people watch, there'll be those people watching and said, oh, but what about the side effects of the vaccine? Is there any concern with that? Obviously,
really.
You speak to your doctor for
sure.
Yeah,
talk to your doctor. I mean, and I know there's a lot of some people are quite suspicious of vaccines and whatnot. I'm not employed by any vaccine maker. It doesn't do me any good to recommend them. But basically, they're actually quite well tolerated.
Okay.
There aren't many reasons not to get them. They don't contain egg products, for example. They don't contain a lot of these contaminants that are considered dangerous. The most common things are a local reaction, like the flu vaccine, actually, where people get sort of a sore muscle, that sort of thing. But talk to your doctor. There are certain people who shouldn't get it. Definitely, if you're immunocompromised, you shouldn't get it. If you're pregnant, you shouldn't get it. Talk to your doctor.
Terrific. Dr. Zach, always a pleasure.
Thank you
so
very much
for joining us. A lot of information here. If you missed some of it, of course, you can go to btmontreal.ca, click on our blog section. We'll have all the information. 0 degrees right now. Looks like a high of 2. Catherine will be back with more details coming up.